Good morning, good afternoon, and good evening, wherever you are. Really delighted to welcome you to the Global Health Supply Chain Summit 2021. This is our 14th year going, really excited for that. The core theme of the event is building for the future, review, recovery, and refocusing. Last year, when we went virtual, we had hoped that we would be seeing the end of the tunnel and actually be able to meet in person. Unfortunately, we're not there yet, so we continue to be virtual this year. Events like this is not possible without generous support from organizations, and I would like to upfront acknowledge support from PAE, which is an organization that works globally across providing solutions to governments. Also acknowledge support from USC Marshall School of Business, Chemonics, who's been a repeat supporter for us for many years. My own department here at the University of Michigan Ross School of Business, and MEPS Global as well. Before I proceed further, I'm sorry, I didn't introduce myself. My name is Ravi Anupindi. I'm a faculty at the Ross School of Business, University of Michigan. And along with my friend, Yehuda Basok, we are co-chairs of this conference. Really delighted to announce that we have, up until 5 minutes ago, 300 people who have registered for the conference. I'm sure many people will soon be joining as we proceed. And as historically we have seen, what I'm showing you here is where the attendees are coming from. It's truly global, and 60+% of our audience comes from the continent of Africa. The regions where they are from the African continent are shaded already: North America, Europe, Asia, and a few people from Australia. Of course, we are time challenged to reach out to the Far East, given the format of this conference, but really appreciate the attendees coming in here. Just to give you a little bit of backdrop, this event, we are in the 14th year, but started several years ago. The first three were held in Zaragoza in 2008 to 2010. And then we had the event in Los Angeles in 2011. And since then, we pivoted and moved to actually doing the in-person events in Africa, because we talk a lot about global health supply chains. Many of the examples come from Africa and Asia. There was one exception in 2014. We had to go to Copenhagen because of the Ebola spread, and there was a lot of uncertainty. Last year we were virtual. This year we continue to be virtual, but we sincerely hope that we can come back and go to being in person next year. I would also like to recognize our organizing committee. Putting this event together requires months and months of work. In addition to our co-chairs, our program committee have worked really hard, and many of them will be here during the 3 days of events. And I would also like to acknowledge program support from Anton and Jana Marie, who are PhD candidates here in the School of Public Health, as well as Susan Booth, who provides faculty support. And finally, I forgot to list there, Sherry Phillip, who manages the backend IT system. There are, in addition, a significant number of students who will support during the conference. I will acknowledge all of them on the last day of the event. Now, I mentioned that we've been hosting this conference, but in addition, last year, we started expanding beyond an annual conference to offer webinars. And what you see here on the screen are 4 webinars that we hosted, one in December in partnership with Chemonics on preparing for the new normal. And then the second one in February with the World Food Program, LMIC in-country vaccine logistics. The idea of bringing these webinars was to talk about what needs to happen. If you can see the date, it was early in the year that we were appealing through the webinars for countries that they need to begin prepare for vaccine logistics in country. The third webinar we did in March, again in partnership with Chemonics, was how do we think about securing demand for COVID-19 vaccinations? There was another panel discussion we did. These are short events, about 90 minutes long. And finally, the fourth webinar we did was with Palladium on putting patients at the heart of pharmaceutical services and systems. So the idea basically is, in addition to the main conference, we would like to continue to host these shorter, 90-minute kind of webinars periodically on topics of interest to our community. That's the whole idea here. In addition, the other activity we have started, we did a small pilot to do a small grant research program. So in 2019, when we met in Johannesburg, that started this discussion. Perhaps we should think about doing some support and on research in the Global South by researchers in the Global South. And that initial pilot led to a fantastic report that we will soon post on our website. This was from Indonesia around investigating incentives in Indonesia's medicine supply chain in terms of counterfeit drugs, etc. So that encouraged us to expand this initiative. And this year, in partnership with Chemonics, we launched a Global Health Supply Chain Research Challenge. I'm really delighted to report to you that we received 38 submissions, which are quite extraordinary, and many high quality submissions. We had a review process that had a team from our organizing committee as well as from Chemonics. We shortlisted 3 for final interviews. Today, we are not going to announce the winner, but the winner of the, we are able to only support 1, but winner of the research grant will be announced on December 9th, 2021. So this is the 3rd day of the conference. We'll announce the winner. So maybe Yehuda, you want to add a few points here on this one in terms of broader appeal?
Yes, we are very proud with this initiative. We hope we can support more than one team. As you see, we got 38 submissions. More than one is very good and excellent. And we would like to support more of them. Perhaps next year we will support 2 or 3 proposals, and we clearly need partners to help us to raise the money and to support this research. And perhaps also we will see in the coming years a follow-up research. So we hope that the groups will do very good research, and we want to have impact, and we want to see how to implement the results of this research, and again, to support follow-up studies.
Thank you, Yehuda. So just to kind of give you a sense for the nature of the programming we are beginning to do, for years we had the annual conference, but now we are adding webinars and small grant research programs, etc. So appreciate all your support for making this happen. Now let's get to the event, this 3-day event. We have a fantastic program starting in a few minutes. We will have the Honorable Minister Dr. Jallah speaking. Minister from Republic of Liberia will give the keynote address. That's followed by a plenary panel on expanding Africa's manufacturing network. Post that, we have a networking session for half an hour, and then we go into parallel tracks and then close with another networking session. So that's the pattern we will structure we will repeat. On day 2, we have keynote speaker Dr. Stavros Nicolaou from the Aspen Pharma Care Group. And on day 2, we have a panel at the plenary level, which is looking back, lessons learned, and preparing for the next pandemic. And then post-networking, we will go again into parallel tracks and close with networking. On the last day, we flip the sequence. We start with the plenary panel. So last day on the plenary session, we are focusing on NCDs. So plenary panel will be improving access to NCD medicines, and followed by a keynote talk by Dr. Bente Mikkelsen from the WHO. And then we'll have parallel tracks. And on the last day, we have a closing session when we will announce the prize competition winner, the research competition winner, and make a few other announcements before we close. Just to give you brief outline of how this is structured. I'm sure if you have logged in, you already are familiar with the FeedLoop platform, the conference platform. So this is the platform that you should be logging in from. And for the plenary sessions, we have live interpretation available in French. So please use those buttons to hear in French if you needed to. I would just like to spend 2 more minutes to talk about how you navigate through this FeedLoop platform. So what we show here is the sessions, and you can click on sessions, and all the sessions are listed here. And you click on sessions on the right, you will get here. And when this image goes live, you will be able to click and you will get into Zoom to be able to participate in that track or session. This is just for track presentation, because the parallel tracks are in the Zoom meeting format where you can raise hand or ask questions, and the moderators will guide you there. Now, we do have poster exhibits in addition to the talks. So some posters, if you go to the poster section in the platform, you will see the poster exhibits. Some of the poster presenters will be available during the networking sessions and host a table. So you'll be able to connect with the poster presenters and have a chat with the poster presenters. We also feature networking sessions on day 1 and 2, 2 networking sessions, and day 3 is a final networking session. Again, and the networking sessions will have tables. You can follow on some topic discussions at the tables, but also meet with some of the poster presenters who may be there on specific days. How do you navigate the networking session? You click on networking and click on the second tab, which is groups, and it will tell you what kinds of tables are there, and you could join the table. But before you join the networking session, you will have to quit the Zoom from the regular sessions that you have been participating in, and then move to networking session. If you need any assistance during the conference, please click on need assistance and send a message, and we will respond to your concern. So again, once again, I would like to acknowledge the support from these organizations. And next, without further ado, I would like to move to the keynote session. But at this point, I would like to first introduce the keynote session moderator, who will then introduce the minister. So it is my pleasure. Sherry, could we have Lloyd on the screen? It is my pleasure to introduce Dr. Lloyd Matowe. He's the director of the organization Pharmaceutical Systems Africa. He currently serves as the Dean of the School of Pharmacy at Lusaka Apex Medical University in Lusaka, Zambia, and having worked in over 20 countries in Africa on the subject matter. Previously, he has worked with the Global Fund in Geneva with Management Sciences for Health. He's been a consultant on supply chain systems for various organizations, including Global Fund, USAID, WHO, UN agencies, Africa Union, East Africa Community, et cetera, et cetera. Very active in academia. He is also currently the chair of the organization People That Deliver Initiative. He's won several awards. He also has for years served as an organizing committee member, has been strong supporter and a strong organizer. Without him, we wouldn't be able to do the in-person events that we do in African continent. So Lloyd, really pleasure to have you here. And at this point, I will hand over to you to then introduce the minister and moderate her speech. Thank you. Over to you, Lloyd.
Thank you, Ravi. Good morning, Washington and Toronto. Good afternoon, London, Geneva. Good afternoon, Abuja, Nairobi. Greetings from Lusaka, and good evening, Delhi, Melbourne. I've got friends in all those countries. Before I introduce the Honorable Minister, it's a pleasure to have this 14th GHSC Summit. We had hoped that we would have this in person, but fortunately it hasn't happened due to the current pandemic. It has taken its toll on human lives, threatened our economies, and exacerbated inequalities. And through it all, women political leaders have shown the way in protecting the health of the constituencies where they work. And in Africa, just before I came to introduce the minister, I tried to enumerate how many women ministers of health do we have among the 54 countries in Africa. And I counted 9. And unsurprisingly, these countries with women ministers of health have been more effective in rallying their communities against this public health scourge. And today, during this meeting, the 14th GHSC, we are privileged to have one of the 9 ministers of health, female ministers of health, speak with us. And of course, this is none other than Honorable Minister Dr. Jallah, Minister of Health, the Republic of Liberia. Honorable Jallah is a medical doctor with over 25 years experience working in her country. And prior to being appointed minister, she was a champion for women's health and child health in Liberia. In fact, I walked twice through her practice during the time I was working in Liberia. And during the Ebola crisis in Liberia, she remained resolute, her practice remained open, and she saved many lives in that beautiful country. To date, she says her goal, and we know her goal remains to build resilient health systems in Liberia and other countries in Africa. Minister Jallah, Honorable, please take the stage.
Thank you very much, Dr. Lloyd, for that introduction. The chairman of this symposium, Mr. Moderator, organizing committee, all of our supply chains colleagues out there, fellow participants. Good morning, good afternoon, and good evening, depending on where you are around the world today. On behalf of the government of the Republic of Liberia and the African Ministers of Health, I am pleased to join you for this 14th Annual Global Health Supply Chain Virtual Summit under the very important theme, Building for the Future, Review, Recovery, and Refocusing. This conference theme aligns with the call to build a robust global health supply chain for the future while reviewing, recovering, and refocusing interventions. Indeed, the past and the present predicts what the future holds for humanity. Therefore, focusing attention on information systems, enabling the global health supply chain to continue planning and delivering high impact interventions, which is vital for the future with the advent of innovative and cost-effective technology solution. Over the last couple of years, global health supply chain have been under tremendous pressure to address the burden of pandemics, epidemics, while meeting routine health delivery needs of the people, especially the vulnerable populations. As such, this conference could not have been more timely to continually review the role and importance of health supply chain system in addressing health system needs of the people. The appropriate selection, quantification, procurement, storage, distribution of essential medicines and medical supplies are critical for maintaining health of all citizens. Without an uninterrupted supply of essential life-saving medicines and medical supply, we cannot achieve HIV epidemic control, eliminate malaria, stop tuberculosis infection, or sustain our collective achievement in reducing preventable maternal and childhood morbidity and mortality, or even increase routine immunization coverage. More importantly, the global mammoth achievement in vaccinating our people against the COVID-19 surge would not have been possible without the consensus effort of global health supply chain actors. For this, the global health supply chain fraternity deserves a great round of applause. Liberia has not been spared from these epidemics as a country and as a people. Before the COVID-19 pandemic, Liberia was inflicted by an equally infectious and arguably more virulent Ebola epidemic. From 2014 to 2016, Liberia was at the epicenter of the Ebola epidemic. It took a collective effort of the government and the partners to plan and intervene to bring the epidemic under control. Without the global health supply chain fraternity taking center stage with appropriate selection, quantification, procurement, distribution, and rational use of personal protective equipment and palliative medicine, the fight against Ebola would not have been possible. The Ebola epidemic in Liberia and the region demonstrate the roles of health supply chain in bringing the world to normalcy amidst shocking and epidemics. Moving forward, from Ebola to current global health crisis, most countries in the Northern Hemisphere have high figures of vaccinated people. However, most of our people remain unvaccinated in Africa. Many countries in Africa, including Liberia, are still in the early phase of their vaccination campaign. So equitable access to vaccines remains a challenge. We continue to call for equitable distribution of these life-saving and life-changing intervention for the whole world as a way of collectively addressing the COVID-19 pandemic. For you in the health supply chain fraternity, we call for expedient innovations and interventions to continue to make access to medical interventions more equitable. We challenge the global health supply chain fraternity to develop more efficient procurement, storage, and distribution solutions, including streamlining the cold chain handling requirement that promotes appropriate management and use of vaccines in remote areas. We call for urgent transfer of technology, capacity, and knowledge for the pharmaceutical industry, especially in developing countries, to allow increased access to medical intervention, such as COVID-19 vaccines. We believe in the increasingly globalized world, where there is no reason for regional or geographical disparity in either health status or the provision of health services. We must strengthen the aggregate health supply chain system that will minimize the risk of stock out of essential medicines and medical supplies for the vulnerable population is paramount. Indeed, The COVID-19 pandemic demonstrated that pandemics knows no boundaries or borders. We must focus our energy towards interventions that will engender local capacity to manage health supply chain solutions within the public and private sector will be vital in sustaining the gains achieved in controlling the pandemic. In addition, galvanizing and applying resources through coordinated public and private sector partnership is vital in revising the trend of the global pandemic like COVID-19. Therefore, I call on all the global health supply chain actors to continue to work together as partners in progress with donors and development partners to increase access to life-saving health products via efficient and effective system will minimize duplication and the waste of resources. With increased demand for health services that require agile health supply chain system and emerging new needs, it is vital that global health supply chain systems continue to coordinate across borders in the use of available resources and innovative on system that will further improve efficiency in health service delivery. Liberia has commenced the journey of transforming our public health supply chain system in collaborating with our development partners through reviewing and revising our implementation strategy based on lessons learned as we build for the future. A robust supply chain improves access to effective, efficacious, safe, high quality and affordable medicine and medical supplies for our people through the Liberian Central Medicine Store for health service delivery via a revolving drug scheme and other financial system. We are also working to improve the supply chain information system to respond to our people's need on validating information that will improve access to essential medicine and medical supplies at the service delivery point. Also, we are strengthening the capacity of our teams as an area of intervention, being focused on enabling us to continue to build for the future in addressing the health service need of our people via a more resilient health supply chain system. Furthermore, we will continue to explore opportunities for partnership with the private sector where appropriate and efficient to improve the quality of health services being delivered to our people through the health supply chain system. Meeting the health needs of our people is at the center of our interventions while promoting equitable access to affordable and quality health services through an effective and efficient health supply chain. We look forward to an opportunity to share our successes and lessons learned with you all in subsequent summit. I want to end by commending the organizer for convening a conference of such importance and significance where the global health supply chain is emphasized and lessons shared among public and private sector teams. I want to acknowledge the contribution of different donors and development partners that have been working with us in Liberia to improve access to essential medicines and medical supplies by strengthening the health supply chain system at various levels of the healthcare delivery. I wish the conference well and hope that shared messages will have its intended effects to make the health supply chain fraternity sharp and a better future. I thank you all.
Minister, thank you very much. We appreciate your presence, and I hope you have an extra 10 minutes for us to answer questions, a few questions from our audience. Those in the audience, please type in your questions for Honorable Jallah. But while we are waiting for them to type, I'll ask you one question, Honorable Minister. In your speech, very powerful speech, you mentioned the word resilience, resilient health system. You mentioned resilience 3 times. Minister, ultimately, what does it take for Africa's systems collectively to become resilient? And in qualifying this question, why has it taken us this long? Thank you, Minister.
Thank you, Dr. Lloyd, for that question. First of all, like we have been hearing all along, Africa must unite. We have a lot of brains. We have a lot of innovative people here on the continent of Africa. We all have to come together to be able to take charge of the health of our people. Together, we can make that difference. We cannot always be dependent. We have to one day become independent, where we have our own, we are making our own vaccination on this continent. That will make it more accessible, more affordable, and we will not have to depend on the rest of the world to supply us. So we need to take charge of those things. We need to have, now that we are building the African CDC, and all of the other countries have gotten national public health institutes within the country. I think if all of us work together, we can all make sure that all of our health systems are very resilient. We heard that in the beginning of COVID, Africa must prepare. Africa must prepare because the health system are weak. So we need to get together, work together as teams, as regions within the African continent to make sure our health system are strong enough to be able to combat any epidemic or pandemic.
Thank you, Minister. Of course, your response could not have emphasized more the adage, divided we fall and united we stand. I seem to hear you say that. We have to work together. We have to begin to work as a unit, as a continent, collectively, the South. That's what I hear you, Minister. Minister, I think there's a question, on the charts. Can you speak, to the impact of COVID-19 pandemic on neglected tropical diseases? And looking forward, what role do you expect global agencies to play in helping countries manage the neglected chronic diseases? Thank you, Minister.
For the neglected tropical diseases, I think the numbers have increased around the continent. I know it has increased here in Liberia. A lot of the original support I have observed have been cut. The support to those programs have been cut. So that have caused, like they said, neglected. They have been neglected throughout this COVID-19. We hope that those who have been supporting the program will help us to begin to find sustainable way of keeping these programs going, even with the meager support that they are getting, that the country themselves can put towards that. So those who are neglected tropical disease champions within the continent of Africa can reach out to those other countries that are not that strong and help them to become stronger, to be able to take the name neglected from these type of diseases and change the name to non-neglected. because I think that meme is so sad.
And Minister, does that response also apply to non-communicable diseases, as with neglected tropical diseases?
Well, the non-communicable diseases were, we have been working, I think a lot of the, around routine services, we have kept up with that. Today we launched, for the first time in Liberia, we launched our screening program for cervical cancer. So while the COVID was going on, we were able to mobilize for non-communicable disease. So we are trying to bring those ones to the front. Diabetes, we did celebrate World Diabetes Day, or we did cervical cancer, we did breast cancer. So we are trying to keep that afloat. We have partnership from WHO and other organizations. So we want to keep those ones on the front burner. For the first time, we're able to do a lot of mammogram, and the screening processes are increasing within Liberia, and I hope that it's increasing around the continent to make sure our women and our women do not die from those preventable diseases.
Thank you, Honorable. One question that a number of people have been asking, Honorable, is the story of Ebola in Liberia. And not only the unfortunate story of Ebola, but the compelling success that Liberia and other countries in the region managed to get the epidemic controlled. The question that people are asking is, how did the lessons learned from Ebola translate into COVID-19?
Well, during the Ebola crisis, community engagement was very important. So we learned how to use our community's structure to filter down messages to all of our people as a bottom-up approach. Then we were able to use our multi-sectorial platform. And then we had the buy-in of the leadership. So when we were translating from the lesson learned from Ebola, it was very easy for us to put those structures that already existed. We just had to wake them up and spread the information to them. And those information were factored down to the community, to where we needed to get the messages to that COVID-19 was here and these are the symptoms. So spread the word. So it really helped us from those lessons learned, because all of our structures were already in place. We only needed the support financially to move them all well.
Thank you, Minister. There's a follow-up question on the non-communicable diseases. The follow-up question is, Minister, what role do you see in the global agencies play, to help countries? So, for example, cervical cancer screening, is there a role for the global agencies? And then add a second question. They're all related, so you can answer them both. The question is, Minister, what is the role of regional agencies, like, for example, the West Africa, community, East African community, Southern African community? What's their role in ensuring preparedness? So there are two questions, Minister, one after the other.
Okay, so the global community, first of all, we have to start with the African global community. Right now, a lot of countries are ahead of other countries. Some countries are behind in terms of setting up for cervical cancer, in terms of setting up for chemotherapy and screening processes. So we're hoping that through the global community that those who are ahead can come and help those who are behind, so no one is left behind, like the term that we always use. No one is left behind. So if we all support each other, and those who do not have, or for example, a cancer or unit, or those who are still struggling to begin screening, if we can support each other by our citizens or our health practitioner coming to your country to train and coming back, or even in the line of dialysis. For example, we want to open a dialysis unit. We need Guinea or any of the other African countries to come to us. Then a little support for them to come and help us start, that would be go a long way. And that would be how we all can take care of each other on the continent.
And Minister, how easy has it been to put your heads together as political leaders, for example, working with other countries in the region, to make sure that we don't continue to work in silos as different countries, as different entities? And how far are we getting institutions harmonized for ease of working together in Africa?
Well, I think we can tell you our own example. Recently in the Sierra Leone crisis, where the tanker exploded, I spoke to the head of state and explained or told the cabinet that it was going to be good to send a team, not only pack up drugs and medical supplies, but a team of healthcare workers to go there to see how they can lend a helping hand. And I think Sierra Leone appreciated the fact that Liberia, their immediate neighbor, reached out and sent a doctor, nurse, PA team to help them along with some supplies. So sometimes you don't have to have a lot, but a little bit counts when your brother is in trouble. So we were able to do that. So you just, as the health minister, you have to reach out to the politicians, or to even though you are a politician yourself, but you are a different kind of politician. So you have to reach to the others and bring all of your ministers and or your other agencies on board, so that they can agree with what you can do for your other neighboring country. We have reached out to Nigeria to see if they can help us with faculty and training, and whatever expertise we have, if you reach out to us, then we can share with you. It shouldn't be a difficult endeavor for all of us to be able to do. People if they are near to you, you can reach out to them while you plan the further distance activities.
Thank you, Honorable Minister. Still a few more questions for you. There's a question for you, Minister. Honorable, with specific reference to COVID-19 vaccination and the poor coverage in the African continent, what must Africa and its political leaders do to ensure self-sufficiency in securing vaccine supply? And can you also comment on the issue of vaccine hesitancy among the African people, and what must be done to mitigate this?
Well, in terms of the getting the message out to our people, I think we have to take that grassroots approach. We need to talk to opinion leaders. We need to talk to other political party leaders. We need to talk to our chiefs, our superintendents, whatever structure that you have within your country. I think this is where we have to go, because we know that there are a lot of people that are against vaccines. And once they speak, a lot of people will listen. So therefore, we have to take that role ahead of them. We are also having a challenge, but this week, or starting the 4th to the 15th, we are using a hybrid approach where we are going. We are not waiting for people to come to us. We are taking the vaccines to them. We are looking forward to try to pass some of the stringent measures that before you enter any public building or before you enter any agency, healthcare workers, we want to see if, as we bring it to the sparkle, which is the committee that the president set up to intervene all these activities, to see how we can make some of these things mandatory. Or even if you're coming into Liberia, we want to make sure that you have a valid, fully vaccinated card. So we all African countries, this is the only way we have to do, like in the European countries where they say before you go to a store, you have to show your COVID-19 test or vaccines. Otherwise, we will be left behind, and then the other countries will go ahead, and later on, they will stop us from traveling to those countries because we haven't done what we were supposed to do as political leaders, as country leaders, as community leaders, to make sure that our people get vaccinated. Now, getting the vaccination is another story. I know the African Union, the AVAC, the COVAX are all purchasing vaccination, and there are other people that are willing to donate, and it's coming in different batches. So hopefully, you know, for Liberia, we are a small country, so we have to even delay some of the vaccines to make sure that we don't have expiries. But we also have to share. If you have too much and another country does not have enough, then you have to be willing, we have to be communicating so that we can share instead of letting any vaccines expire.
Thank you, Honorable. Quite insightful. It is, and interestingly, the challenges we face across the African countries continue to be similar, and they are similar. So listening to the Liberia story, and Liberia as a case studies, nothing strikes us who are on the continent as is something unique to Liberia. Honorable, there is a question on last mile. These are two questions together on the last mile. One of the person in the audience is talking about the infrastructure. We do face infrastructural challenges like poor transport networks, poor communication coverage, and how can these be overcome? In other words, how do we ensure the provision of this supporting infrastructure in every community? And a similar question is asking, Honorable, what systems are in place to address medicine gaps in the remote rural areas?
First, we need roads to health. Roads to health. Because for us in Liberia, our challenge is roads. A lot of the rural area is not accessible because there are not good road connectivity. So what we will want is for, first of all, if we can have coastal roads or inland roads that will enable us to be able to reach to the last mile to make sure that they too receive the kind of care that they need. But for essential drugs, even in the hard to reach area, the most important thing is, like I said in my speech, we have to have a revolving drug fund. So wherever the facility is, there has to be a way for them to be able to cost recover what is given to them. If you don't have any, if everything is free, then there will always be a liability on either your partners or your system. And there will always be stock out and shortage of essential drugs. So if we can get our program started where even the most remote community has a drug revolving, where even if it's $2 or $1, that you pay for the drugs so that your community center can be able to replenish. We're all waiting for the greater or for the bigger purchase of drugs. I think we'll be able to supply every area and every community, even down to the last mile.
Thank you, Minister. The last mile continue to be a thorn in the path for not just governments, but also for implementing partners, technical agencies. And it has been for over 3 decades, 2 decades. And I hear you from what you're saying, we shouldn't be talking about challenges of the last mile 10 years from now. And that's what you leaders are saying to us. And Honorable Minister, we're getting to the end of our session, but we have a panel discussion that's following your keynote. And you spoke about hesitancy. And in your speech, you spoke very clearly about the discrepancies in access to vaccines. And our panel, Honorable, will be talking about expanding vaccine manufacturing network, not just in Africa, but across. Before they come in the next 10 minutes, what advice do you have for these panelists about the manufacturing of vaccines across different geographic areas of the world? Would like to hear your thoughts as a political leader and as a representative of the continent today.
One thing I would say, teach us to fish and not give us fish. We're receiving vaccines right now. But if we have the right and the right manufacturing companies, the right technology and the right people, we should be able to make vaccines around this continent and to be able to supply all of our people. So I will hope the panelists will focus on how we will be able to get some of the rights and charters, because I think you need certain rights or certain documents and certain reagents to be able to manufacture any vaccines around the continent. So I think now is the time that we can receive all of what the support that we need. So if there's any other future pandemics or epidemics, or even our routine vaccination, that we will be able to produce them on a continent so that there will be no delays in our people receiving the due vaccines that they need. Thank you.
Minister, my last question to you, as a leader, as a clinician, as a physician, what has been the most frustrating thing about the current pandemic?
Well, it's getting the people to comply. Even with all the community, all of the things that we have done, people will delay. When they heard about COVID-19 in the beginning, everybody thought it was like Ebola. So people were more willing to comply. Then after that, people slowed down, everybody went to business as usual. When we had the third wave in June and July, where a lot of people, I think for us, if 50 to 100 people die, then there's a lot of people. Where we saw a lot of death, everybody got serious and got more concerned. And they wanted their vaccines, they complied, everybody wore their masks. Even those who didn't have masks before, they found masks and they wore it. But now, they all gone back, to business as usual because our numbers are pretty low. But we're hoping that with Omicron on the rise, that they will begin to think, and this will be the factor that will compel them to be vaccinated as we go around asking them and bringing the vaccines to their doorstep to make sure that they are protected.
Minister, we thank you very much. There are some comments in the background from those in Africa who are very, very proud of you and the speech you have given us today. Before I let you go, I would like to invite our co-chair, Ravi, to please give a vote of thanks to the minister, or Yehuda, please, one of you.
Yeah, can you hear me okay?
Yes.
Wonderful.
Yes.
Thank you so much, Honorable Minister. Very engaging speech, but also very, very engaging question and answer session. I know you have a very busy schedule as a leader in the country. Truly appreciate your taking time and coming and sharing your perspectives, not only from your country's perspective, but also from the region and the continent's perspective, and answering a very wide variety of questions. So I think some of the issues that you have discussed are the core themes of the event for today and the next 2 days. So your comments and perspectives actually set the stage. So really appreciate you taking time and coming to our conference and opening this conference today. And thank you, Lord, for great moderation of the talk, and appreciate it. Thank you so much.